What if your arteries are struggling right now, and you feel mostly fine? That's the scary part. Artery stress can whisper for years before it screams. No big warning. No dramatic pain. Just small clues that many people brush off as normal aging, tiredness, or bad sleep. In this video, I'll walk you through 9 silent signs that your arteries may be under stress, what those signs can look like in real life, and what to do next, calmly, clearly, and without panic. Think of this as an awareness check, not a fear trigger. And quick note, this is educational, not a diagnosis. If something in this video matches what you're feeling, especially if symptoms are new, getting worse, or showing up together, please talk to a healthcare professional. Alright, let's begin. What arteries under stress really means, in simple words. Your arteries are the highways that carry oxygen-rich blood to your heart, brain, and the rest of your body. Over time, arteries can become narrower or stiffer. This often happens due to plaque buildup, inflammation, and reduced blood flow. The tricky part is that your body sometimes adapts for a while, so you don't always feel clear symptoms early. But your body still sends signals. They're just easy to ignore. 1. Leg cramps or pain while walking, then relief when you stop. One of the clearest quiet clues is discomfort in the legs that shows up during movement and eases during rest. You start walking, maybe to the store, around the house, or up a slight incline, and you feel aching, cramping, tightness, or heavy fatigue in the calves, thighs, or even the buttocks. Then you stop for a minute, and it improves. Many people think, my legs are getting older, or I'm out of shape. But this pattern, pain with activity, relief with rest, can be a sign that blood flow to the leg muscles is reduced. Muscles need more oxygen when they work. If the supply can't keep up, the muscle complains. If this happens repeatedly, don't just push through it silently. It's worth discussing with a doctor, especially if you also notice cold feet, slow healing, or numbness. 2. Unusual fatigue that doesn't match your day. We all get tired. But unusual fatigue feels different. It's the kind where a normal day feels strangely heavy. You wake up and feel not restored. You do simple tasks and feel drained too quickly. Your energy feels lower than your life situation would explain. When arteries are under stress, the heart may need to work harder to push blood where it needs to go. That can create a quiet energy tax on the body. Also, if tissues aren't getting strong blood flow, the body can feel sluggish and foggy. Fatigue alone can come from many causes: sleep issues, anemia, thyroid problems, low mood, so don't self-diagnose. But if this tiredness is new, persistent, or paired with breathlessness or chest pressure, take it seriously and get checked. 3. Shortness of breath with light activity. This is a big one that people normalize too quickly. If you feel out of breath doing things that used to feel easy, climbing stairs slowly, carrying groceries, walking from one room to another, your body may be telling you oxygen delivery isn't as smooth as it should be. Sometimes the lungs are the issue. Sometimes fitness is part of it. But when arteries are narrowed or the heart is under strain, the body may struggle to meet oxygen demands, even during simple effort. Pay attention to patterns. Is this new? Is it happening more often? Is it paired with chest tightness, dizziness, or fatigue? If yes, that's a strong reason to speak to a healthcare professional. 4. Subtle chest tightness or pressure, not always pain. Many people imagine heart-related symptoms as sharp chest pain. But one silent clue can feel more like pressure, heaviness, tightness, or a squeezing sensation. Some describe it as someone sitting on my chest, or a band around my chest. It may happen during physical effort, emotional stress, or after a heavy meal. It may come and go. And because it's not always intense, people dismiss it. This kind of feeling can be linked to the heart muscle not getting enough oxygen-rich blood at certain moments. It is especially important to take it seriously if it appears with shortness of breath, sweating, nausea, arm discomfort, jaw discomfort, or sudden weakness. If chest pressure is new or concerning, don't wait. Get medical advice promptly. 5. Cold hands or feet that feel different than usual. Some people naturally feel colder than others. But here's what matters: a change. If your feet or hands are suddenly colder than usual, or one side feels colder than the other, that can sometimes point to reduced blood flow to the extremities. When arteries narrow, less warm blood reaches the farthest areas like toes and fingers. People often blame weather, floors, or poor circulation without asking why circulation is poor in the first place. If cold feet come with numbness, color changes, pain while walking, or wounds that heal slowly, those combinations deserve attention. 6. Erectile dysfunction, often an early warning in men. This topic gets avoided, but it matters. Erectile dysfunction can have many causes: stress, diabetes, hormones, medications, mental health, sleep. But persistent ED can also be one of the earlier signs of reduced blood flow because the blood vessels involved are smaller and can show changes before bigger arteries cause obvious symptoms. For many men, this sign can show up years before major cardiovascular symptoms. That's not meant to scare you, it's meant to empower you. If ED is persistent, don't just treat it like an isolated issue. Use it as a reason to check overall cardiovascular health, especially blood pressure, blood sugar, cholesterol, weight, and lifestyle factors. 7. Dizziness or lightheadedness without a clear reason. A sudden dizzy spell can come from dehydration, low blood pressure, inner ear issues, anxiety, low blood sugar, or medication side effects. But repeated lightheadedness can also relate to reduced blood flow reaching the brain consistently. Some people describe it as "I stood up and the room spun," or "I felt faint for a moment," or "my head felt floaty." If that happens often, especially with chest pressure, shortness of breath, or weakness, don't ignore it. Your brain is extremely sensitive to changes in blood flow. It reacts fast. If dizziness is severe, new, or comes with face drooping, arm weakness, speech trouble, or sudden confusion, treat it as urgent. 8. Slow healing cuts or sores on feet or legs. This is one of the most overlooked clues. Healthy circulation helps deliver oxygen and nutrients that support healing. When blood flow is reduced, even small cuts can take longer to close. You might notice sores that linger, skin that looks shiny, or areas on the feet that keep breaking down. This is especially important for people with diabetes, because diabetes already increases risk for circulation issues and nerve changes. But even without diabetes, slow healing on the lower legs and feet can be a signal that the tissues aren't getting what they need. If you see wounds that don't improve, get them checked. Early care prevents bigger problems later. 9. Jaw, neck, or back discomfort that feels random. Here's another quiet sign that confuses people: discomfort that shows up in the jaw, neck, shoulder area, or upper back, sometimes during exertion, sometimes during stress. People often assume it's posture, sleeping wrong, or muscle strain. And yes, it can be. But in some cases, this discomfort can be a referred signal, meaning the body feels the issue in a different place than the source. If jaw/neck/back discomfort appears with fatigue, shortness of breath, nausea, sweating, or chest pressure, take it seriously and seek medical advice. When to seek help quickly: no panic, just clarity. If you notice symptoms like chest tightness plus breathlessness, or dizziness plus weakness, or multiple signs together, don't delay. Early evaluation can prevent major events. Also, if one sign on this list fits you strongly and it's new or worsening, it's still worth discussing. Getting checked is not overreacting. It's smart prevention. There you have it, 9 silent signs that your arteries may be under stress. From leg cramps and unusual fatigue to chest tightness and slow healing wounds, these subtle clues can give you an early indication that something's not quite right with your circulation. Recognizing them early is key to preventing serious heart events like heart attacks and strokes. Remember, taking simple steps today, like improving your diet, staying active, and managing stress, can make a big difference in protecting your arteries and overall health. If you notice any of these signs, don't ignore them. Talk to your doctor for early detection and personalized advice. If you found this video helpful, be sure to like it, share it with others who might benefit, and subscribe to the channel for more practical health tips. Thanks for watching, and take care of yourself. Your body will thank you later. See you in the next video.